Hello and welcome to another video version of Beauty by Buford. This weekend I had the opportunity and the honor of participating in an advisory board in Toronto, Canada for a new injectable called Voluma. Voluma is being released by Allergan, is going through the FDA process, and hopefully will be available to practices such as mine in the next few months. What I learned is not only how effective Voluma can be, but more importantly, how to accurately assess and how to treat facial aging. In speaking with some of my colleagues who are top derms and top plastic surgeons from around the world, it became very apparent that the ways of treating and the ways of diagnosing and the ways of educating patients about facial aging have certainly changed and continue to change. And I think this is very beneficial for you, the patient, and I want to give you some of this information so that you can take this to either myself or to any other injector and see how much they actually know about facial rejuvenation and how much on the cutting edge they actually are, how advanced they are. So first, looking at facial aging, the number one thing that most of us used to address were lines or wrinkles. Unfortunately, lines or wrinkles only go so deep, and only in treatment of these is as effective as the superficial skin. Instead, we then moved on to volumization. Unfortunately, at this point, many physicians simply focused on inflation and restoration of volume, but not necessarily understanding where this volume should be replaced. Instead, we now talk about reflation. What is reflation? Reflation is effectively replacing volume in areas where it was actually lost. We're not looking at adding volume in a random, haphazard manner, but instead in a very, very focused manner. In other words, where do you lose volume in your face? We know from cadaveric studies that there are discrete fat pockets or fat compartmentalized compartments of fat in the face that we lose as we age. If these fat pockets are effectively treated and volume is replaced in these areas specifically, we can restore volume to the face in a much more natural manner and reflate the face and not effectively volumize it. Now again, these are two very similar sounding terms, but in reality, they're very, very different. So if you look at the face, most of us did treat the nasolabial folds. Unfortunately, if you look at my nasolabial folds, if I treat and add volume to these areas, I end up with a very flattened midface. This is a mistake that a lot of injectors make. But instead, if you notice here where I've lost volume and here where I've lost volume, in adding that volume, you effectively raise the face and restore a more heart-shaped face or a more angulated face. Okay? As we age, our face becomes more squared off. So simply addressing volume in the nasolabial fold is antiquated, outdated, and it's effectively a treatment that we no longer look at as educated injectors. So from there, we look at then other treatments that we can use to improve the overall appearance of your face. So what are these treatments? Well, if those of you that have heard me speak know that I emphasize the holy triad, and that is three things that are non-surgical. Number one, medical skincare. Number two, facial injectables. Number three, lasers. So talking very briefly on these points, number one, medical skincare is essential. If you are not using a medical skincare product, you're effectively cheating yourself of tremendous improvement, and you're stalling your process, or your progress, I should say. If you're in your 30s, if you're in your 40s, you absolutely need to be on medical skincare, especially in areas such as Denver, Colorado, where it is so dry. Your face necessarily needs these products and not the over-the-counter products where 99.9% of the overall revenues of those companies are spent on marketing and not research and development to create solid products. So medical skincare is essential. Number two, facial injectables include products such as Botox or other neuromodulators such as Dysport or Xeomin. These effectively treat the underlying muscle, which then softens lines and wrinkles by diminishing the overall pull of the skin from the underlying movement of the muscles. Number two in this area then would be replacement of facial volume or reflation, specific placement of this volume via products such as Voluma, Juvederm, Restylane, Perlane, Radiesse, and so forth. Number three is the use of lasers. And the lasers that I use are the fractional CO2, which is very effective for tightening skin, for improving overall lines and wrinkles, and improving the overlying canvas of the skin. The other type of laser that I use is actually not a laser, it's actually a light source, and that's IPL. We refer to that as intense pulse light, and it's very, very effective for brown spots and for redness. So these are some topics that you should keep in mind next time you come to either myself or any other person for addressing facial aging. My goal with these video snippets is to effectively educate you on topics that may not be available from your injector, but that keep you informed, keep you educated, and keep you on top of the curve. So if you have any questions, I'd be happy to talk to you. Call my office at 303-747-6719, or email me directly at drbuford, that's Dr. Buford, at beautybybuford.com. You can also visit our website at beautybybuford.com. Thanks again for taking the time to watch this. We look forward to working with you. Have a great day.